Welcome to Health Talks. I'm Gail Hogan, and today we're talking with Dr. Lisa Hickman, a nationally recognized expert in pelvic floor disorders and pregnancy. Welcome, Dr. Hickman.
Thank you for having me.
What is a pelvic floor?
So the pelvic floor is a bowl of muscles and connective tissue that attach to your bony pelvis, and it provides the support to all the pelvic organs that sit in the pelvis, like your bladder, your rectum, your uterus, cervix, vagina for our female patients. But men have a pelvic floor too.
So we're talking about pelvic floor disorder.
Correct.
I don't even know what that means.
So, pelvic floor disorders are just a generic term for conditions when those supportive tissues aren't working like they're supposed to. So that translates to things like prolapse, which is like a hernia of the pelvic organs into the vagina, or problems with bowel and bladder control, pain with intercourse, things like that.
Does it happen because, and you mentioned women and men, but this is mostly women that have this disorder, I would assume?
So, I'm a urogynecologist, which means I specialize in women who have pelvic floor disorders. There are men that can have pelvic floor disorders too, but those are typically managed by different physicians than my specialty, which is focused on the care of women.
So is this because of childbirth?
So childbirth is a contributing factor to pelvic floor disorders. We know that increasing number of pregnancies, and more specifically vaginal deliveries, can contribute to the development of pelvic floor disorders. And if you think about it, it makes sense because growing a baby in your uterus is a lot of pressure on your pelvic floor. Most women complain of increased pressure in their pelvis as they get further along in pregnancy. And most women too complain of having to empty their bladder more frequently because of that pressure on their bladder, or leaking urine accidentally in pregnancy. And so, yes, that pressure on the pelvic floor can help contribute to these conditions in the future. And then vaginal deliveries, also, if you think about it, as the baby comes through the birth canal, it puts a lot of stretch on those muscles. We know that many women experience a tear during their delivery, and that can be tearing into the muscles that support the pelvic organs. And so all of those things together can contribute to pelvic floor disorders.
And multiple pregnancies?
So yes, we do think that as the number of pregnancies and vaginal births more specifically go up, the risk of pelvic floor disorders also do increase. But there are other things that contribute to pelvic floor disorders.
Is there a number that you can put on, or a percentage of women in the population that have this?
So it is unbelievably 1 in 2 women will experience a pelvic floor disorder in their lifetime. But many women don't talk about these conditions because they're embarrassing. Many women don't even want to bring it up with their providers, let alone their friends or family members. And so it's certainly possible that the number is even higher than 50% of women.
Well, are there symptoms? Maybe some women don't know they have it?
Sure. So pelvic organ prolapse is a hernia of the pelvic organs into the vagina. The most common symptoms are a vaginal bulge sensation or a pressure or fullness. The bladder control issues are things like urinary frequency and urgency to use the bathroom, nighttime peeing, or leaking urine when you are not in the bathroom. So whether that's with cough, laugh, sneeze, and pressure on the pelvic floor, we call that stress incontinence, or there's overactive bladder, which is involuntary leaking on the way to the bathroom when you have an urge to go. And then there are bowel control issues too, and these are ones that I think are the hardest for women to talk about with their providers because it is extremely embarrassing.
And I wouldn't think that that would be tied to the pelvis, honestly.
Yeah, well, a lot of people don't. And, many women and, people in general don't even know that my specialty, which is,
that's why you're here today.
Exactly. That's
people.
why we're here. Yeah. They don't even know that our specialty exists to treat these conditions, but there is a whole field of providers just like me that focus on treating this every day because it's so common.
You mentioned pregnancies at putting some women at risk. Are there other women at risk, besides pregnancy, that would put others in the population at risk?
Absolutely. So things that we think of are anything that puts chronic stress on the pelvic floor. So things like chronic straining, individuals who are chronically constipated, individuals who chronically cough, power lifters, believe it or not. Anything that chronically puts increased pressure on the pelvic floor. We know some women have, genetic disorders of their connective tissue. It doesn't support things as well. We know that family history can be a contributing factor, obesity, increasing age, menopause, all of those factors. In fact, women lose muscle mass as they age. All people do. And so that is another factor that contributes to weakness of the pelvic floor.
We discussed some of the symptoms earlier, but can you sort of outline them so that someone would know what to look for, or as they're watching this think, oh, that could be me?
Yeah, absolutely. So, pelvic pressure, a bulge sensation, women often tell us that they feel something when they're, after using the bathroom or when they're showering, feeling like you always have to go to the bathroom, having to rush to the bathroom, leaking, urine or stool, pain with intercourse, and, a variety of other symptoms. But those are the main ones that should clue women off that there is something going on and maybe they should talk to someone about it.
After a woman is pregnant and delivers, how soon would these symptoms show up? Is this something that you see as you age?
What I would say is that I have a subspecialty clinic where I see many women after they have a baby. And we know from this specific patient population that many women have some transient bowel or bladder control issues postpartum. But many times those symptoms spontaneously resolve as they get further out from their delivery. There are a handful of women, though, who benefit from seeing a specialist like me or getting involved with a pelvic floor physical therapist who can help them re-strengthen their pelvic floor muscles. But also, aging is a major contributing factor.
And when you talk about helping women strengthen that, is that like a physical therapy type work that they do?
It is. So there are specialized female pelvic floor physical therapists, and these are therapists who are trained in the pelvic floor, and they help you strengthen those muscles, coordinate your muscles. Learning how to relax your muscles for some of my patients too is a really important factor in treating and managing pelvic floor disorders.
What do your patients tell you that they wish they'd known before they knew that they had this, or that maybe someone had talked to them during their pregnancy that you might want to look out for this as a possibility? What do you hear?
So, many women don't even know they have a pelvic floor. And so just the education in general of you do have a pelvic floor, here are things you can do to strengthen it. And also, I think this whole idea of rehabilitation, especially after a vaginal birth, but after pregnancy in general, is so important. And I liken it to a sports injury. If you had a sports injury, you would, go to physical therapy and rehab those muscles. Why is the pelvic floor any different with childbirth? It really shouldn't be.
And so those are the kinds of misconceptions that you hear from women and men too, I suppose.
Yeah, so, they are the misconceptions that I hear from patients. Like, I wish I would have known. Many patients don't realize that they could have bladder or bowel control issues. The major thing they're thinking about is, what's going to happen with my pregnancy? How am I going to deliver this baby? How am I going to be as a mother? Those are patients' major issues. They have no idea of the short and long-term consequences that can happen after, a tear during delivery or a vaginal birth.
You mentioned the clinic at Ohio State for helping women with pelvic disorder. What else can you offer these women at Ohio State?
There are so many innovative treatments that we have here. I think early entry into care is really important. It's this idea of prehabilitation before the injury happens or rehabilitation afterwards, so that it's secondary prevention for pelvic floor disorders in the future. But education, a variety of, office-based treatments, subspecialty treatments with different team members like physical therapists, and also we have surgical management options. And while those aren't things that I'm offering to a newly postpartum mother, we have a great variety of treatments for our patients at Ohio State.
Does diet have anything to do with this? Lifestyle have anything to do with this?
100%. So behavioral and, lifestyle modifications are things that I talk about to my patients all the time. We know that there are certain things that are bladder irritants, like, caffeine can make it more frequent or more urgent for you to use the bathroom. Maintaining a healthy weight, cutting back fluids before bed, not drinking a gallon of water a day unless you're recommended by another provider, because what goes in has to come out. All of those things can impact some of these symptoms that women complain to us about.
is this going to be a long-term or a lifelong condition for these women?
I would say it depends. We have really great treatment options for many things, many of the pelvic floor disorders that we discussed. And so, my goal is to get women's quality of life back so that they don't have to suffer with these conditions.
And I'm sure that they are grateful for the fact that there's someone like you at Ohio State. Is there any research going on in this area?
Oh, there is so much research. So I would say, just like many people don't know that our field exists, we're also a younger specialty in the grand scheme of things. And there is just continual research about the best way that we can manage patients with pelvic floor disorders, including my passion, which is women who have pelvic floor disorders in pregnancy and postpartum.
As a physician, what's your goal?
My goal is to provide excellent care of patients and also change the paradigm of the way that we manage patients, because if we can do interventions when women are younger and they still have the muscle mass, then maybe we can prevent pelvic floor disorders down the road.
Dr. Hickman, thank you so much for joining me.
Thank you so much for having me. It's been a pleasure.
And thank you for watching Health Talks.